Biz Talk Radio.
And welcome back. It's Frankie Boyer. Well, there is some disturbing news that has come out recently about ADHD diagnosis, and it has to do with the fact that people that have ADHD, and I'm one of them, is they have an increased risk of dying young. And joining us today to discuss this disturbing story is Dr. Rob Melillo. And I'm not sure, is it because of the risks that people take that have ADD? Is it the accidents? Is it all of that? Or is it some of the medication that some of the people have chosen to take? But it is obviously a very, very disturbing story. This is so disturbing because I'm one of those people that has ADHD, as you know. So what's the deal? Why are people diagnosed with ADD and ADHD at a higher risk of dying young?
Well, when you look at ADHD, this is one of the things that I've been talking about for a while, and really, there's a lot of things to be concerned with. For instance, starting childhood, you have 32% of children with ADHD drop out of high school as opposed to 15%. There's a 300% increased risk of ending up in the ER room with an accident. There's a 200% increased risk of having some sort of substance abuse issue. There's a 300% increased risk of having dementia later on in life. And now we see that there's a 200% increased risk of earlier death. And all those other factors come into play, meaning that if you have an increased risk of obesity, if you have an increased risk of having an accident, if you have an increased risk of substance abuse, all of those things can contribute to, having a problem with earlier deaths. We know that, a while ago there was some research showing that people with ADHD end up in the ER room a lot more. And a lot of it probably has to do with the fact of not paying attention, being distracted, not concentrating on what you're doing, and also lifestyle. We don't know at this point in this study whether it also has to do something with, being on drugs for ADHD, whether that is a contributing factor. But you're talking about, there's an 500% increased risk of sudden cardiac death if you're on drugs like Adderall.
Yeah. I can see, I said that before you came on, it's because of the distraction. I think, it's absolutely because of the distraction. We don't, we focus on what we want to focus, and sometimes the bigger picture isn't really there.
Well, part of it we also know is, again, Frankie, we've been talking for years that my work is really looking at what is actually happening in the brain of someone with ADHD. And what we know is that it is a developmental delay and underactivity in the right side of the brain. And we know the right side of the brain is more tied to autonomic regulation. It's more tied into regulating our heart and our digestive system. It's more tied into regulating our hormones and our blood sugar system. And it's been known for many years that if people have right brain injury or right brain strokes, they're more likely to die earlier. So I think, we have to look at the idea of, the brain, the right brain deficiency, and how that plays a role also. In my first textbook, I really went through there's a lot of research on that, looking at earlier death in people with right brain stroke as opposed to people with left brain stroke. Mm-hmm. So I think that plays a role in it as well.
So the problem is what? How do we get focused? How do we get kids to understand how serious this is, and how do parents deal with this? I mean, this is, if you're a parent right now and you're listening to this interview and you're saying, wait a minute, are you telling me that my kid could die younger, and what can I do about it? What do I do? Right, exactly. And that's the good news, is because,
we've been working with this. I've been working with this. We've worked with, at Brain Balance, we work with, this year we'll work with probably close to 10,000 families across the United States. And we've published 2 major papers in 2 major scientific medical journals showing that kids that have gone through our program that within 3 months, 81% of them no longer have ADHD. The idea that ADHD is something permanent that you can't get rid of, that it's purely genetic, is completely false. That doesn't fit with any of the scientific literature that we're seeing lately. And so it is completely changeable. And it is something that with the right types of activities, tomorrow the new edition of my book, Disconnected Kids, this is the second edition, comes out. Been one of the best-selling books on this subject since 2009. And it is a home program for parents. So for $10, people can take the book, understand what's actually happening, what is ADHD, do the activities and the exercises in the book, which is really an individualized right brain stimulation diet and nutrition program for an individual with ADHD. And it will show significant improvement just from that. But other than that, it's something that can be completely correctable. And when you start looking at how this may be long-term with your child, that they may die early, that they may drop out of school, that they're so much more likely to have substance abuse, obesity, some sort of an accident, there's an 80% chance of divorce. Those are the things that you're talking about. Everybody wants their kids to be happy. They have ADHD. The chances of them being happy are not there, and it can be completely eliminated and changed.
There's also this connection between dentistry and air passage and airwaves, where we're not breathing enough. And it's a fascinating subject that I have a dentist, a specialist, coming on tomorrow talking about that. So it fits right in with what you're saying, Dr. Melillo. What's the best website?
If they're interested in finding out more about me, my work, my books, they can go to drrobertmelillo.com. If they want to find out, we have over 80 brain balance centers now in the United States. They can find the nearest one at brainbalancecenters.com.
Wonderful. We'll get you back because this was too short. We'll do a longer segment and really get into it because this was just a tease. Thanks so much, Doc. Nice to have you back.
Great, Frankie. I appreciate it.
And
okay, you too.
We will be back in just a moment right here on Biz Talk Radio. This is Frankie Boyer. Stay tuned.
Close your eyes and I'll kiss you, 'cause with the birds I'll share. With the birds I'll share this lonely view. And with the birds
Staying healthy and building immunity begins in your gut.